Now we turn to this growing concern over measles in this country. New numbers out from the CDC show the outbreak has grown to 102 cases in 14 states. And now we're seeing politicians entering the fray, possibly at their peril, over whether children should receive the measles vaccine that once eradicated the disease. Our report on that tonight from NBC's Hallie Jackson.
An overseas trip is making headlines here at home after Governor Christie's controversial comments on whether parents should vaccinate.
Parents need to have some measure of choice in things as well. So that's the balance that the government has to decide.
Christie's position, weighing personal freedom versus public health, raised eyebrows, considering during the Ebola scare, he imposed a mandatory quarantine of a healthy nurse to protect the public. The quick backlash prompted Christie's office to walk back those remarks and clarify his support for the measles shot as this public health conversation turns political.
I've heard of many tragic cases of walking, talking, normal children who wound up with profound mental disorders after vaccines.
But the vast majority of doctors say the shots are safe, and so does President Obama.
There is every reason to get vaccinated. There aren't reasons to not.
In New York, an infected college student may have exposed hundreds of commuters at busy Penn Station. And in California, a Santa Monica daycare says 14 infants under a year-old will be quarantined for 3 weeks because of a potential measles exposure. Erin Richardson's son is having a similar experience at a different preschool.
You're on day 4 of your quarantine. How's it been?
I feel tired of quarantine.
Her toddler, Jaden, has had his first measles shot, but since Jaden's compromised immune system may make him vulnerable to the virus anyway, health officials want him isolated for now.
Every child that can be vaccinated needs to be vaccinated to protect the kids that can't, such as Jaden.
Most states let parents opt out of vaccinations because of religious beliefs, and 18 states also allow exemptions for personal reasons.
Some people, because of a mistrust of authority, a mistrust of the government, some people just don't want to hear the correct information. They've made up their mind, and they're very stubborn about it.
It's why doctors are fighting this outbreak on a new front, the court of public opinion, to keep the public healthy. Hallie Jackson, NBC News.